Okay, that's it. So after completing in detail the placenta, we will go to this topic, gestational trophoblastic disease. But when we look at this one, in the membrane I told you we have a trophoblast. See this trophoblast. This is again an intermediate trophoblast, but telling intermediate trophoblast won't do. You have to say it is chorionic type intermediate trophoblast. And do you think it is infiltrating? No, right? Very bland looking, monotonous, right? And in fact, if I can tell you, it is cohesive, right? It is kind of a polygonal, it is kind of a monotonous, right? And it is kind of a well circumscribed. And in fact, I can use this term. Don't you think it's looking squamous like? I can write. Believe me, they also express P63Is, just the same as squamous, right? So the importance of knowing this normal finding. This is a normal finding. You will get in the membrane. I already shown this finding. But importance of knowing this finding is that if you are getting a tumor of this chorionic type trophoblast, they will mimic like squamous cell carcinoma. They will have IHC P63 positive, right? I forgot to tell you the IHC of this implantation site or intermediate trophoblast. That's human placental lactogen. So if I tell you a tumor is of intermediate type, implantation type intermediate trophoblast, the IHC should be used is human placental lactogen, right? HPL. And another new IHC, I believe usually few people know about that. It is MELCAM. That is again IHC for implantation site intermediate trophoblast. Believe me, these two are IHCs. And if you are getting a tumor arising from this, we are going to use this IHC. Fine, clear? So this is kind of a summary. We have cytotrophoblast, in situ trophoblast, everyone knows, right? But in case of intermediate trophoblast, we have implantation site. Which IHC positive? Which IHC positive? Yes, HPL. Perfect. What else? Which IHC? MELCAM. Right? And are they infiltrative or circumscribed? Infiltrative. You know that, right? Are they infiltrating the vessels? Yes, they are infiltrating the vessels. I will tell you. I will show you the finding there. And when you talk about this one, chorionic type intermediate trophoblast, tell me the IHC P63. What should be the look? Squamous cell carcinoma like look, epithelioid like look, right? Circumscribed or infiltrating? Circumscribed. Clear? And for that, we have two tumor. You need to remember two tumor each. Two tumor for implantation site. One is exaggerated placental site. Obviously, see, obvious thing you don't remember. The term already is there, placental site. What do you think? In placental site, obviously implantation site will come, right? Chorionic site is far away, right? And number two, the malignant form. This is a benign form. This is a benign form. If I can write here, this is a benign form. There is just an exaggerated reaction, whereas this is a malignant form. Placental site trophoblastic tumor or PSTT, right? Both have similar IHC. The only thing will help is the morphology. Similarly, when you talk about chorionic type trophoblast, there is again a benign form and a malignant form. One is a placental site nodule, and another one is a epithelioid trophoblastic tumor. Here I want you to remember this point. See, whenever I say placental site, any disease is telling placental site, and I will ask you, what is the kind of trophoblast you are expecting? What you will tell? Definitely will say implantation site. Here you will commit a mistake, and that's why I want you to remember this one only. Only this one you remember. Rest everything is obvious. You know the normal. You can guess that. What I am using the mnemonic is that rather than writing nodule, please write it as, or please remember it as nodule. The disease is telling no. It is telling it's nodule. Don't get biased. Don't get biased. Please don't say implantation site. I am chorionic type. Right? That's the kind of a mnemonic I have developed. Whenever I read placental site nodule, I will write placental site nodule, right? That's it. That's a chorionic type intermediate trophoblast. And epithelioid trophoblastic tumor, obviously you know chorionic is circumscribed. It is epithelioid, so it is giving a malignant form. Easy, right?